Young researchers need to know this. Research is not so esoteric or as big as people think. Nobody will develop this space for us. We have to do it ourselves.
Welcome to Science Capsule. Science Capsule is a Getz Pharma podcast series where we have conversations with experts in the field of medical research. My name is Aderonke Yusuf. I am a pharmacist in Nigeria and I work with Getz Pharma as a product manager. Today, I have with me a very special guest, a seasoned professional and an administrator. He is a medical doctor and an endocrinologist. I have with me Professor Olufemi Fasanmade. Professor Olufemi Fasanmade is the current president of the Endocrine and Metabolism Society of Nigeria, and he is also the immediate past chairman of the Nigeria chapter of the American Association of Clinical Endocrinologists. He is currently the unit head of Endocrine, Diabetes and Metabolism Division in Lagos University Teaching Hospital, Nigeria. He is the chief clinical coordinator at NSIA, Nigerian Sovereign Investment Authority, and Lagos University Teaching Hospital Cancer Center. He is a board member of the Diabetes Foods Nigeria Foundation, and he has authored and co-authored 5 books and has 120 publications in peer-reviewed journals and more than 300 abstracts and posters presented locally and internationally. He has been involved in several research studies and had several grants, including that of the American Diabetes Mellitus Study Group, which has brought so much new knowledge around diabetes susceptible genes in Africans and African American. Till date, he has trained and supervised more than 30 fellows in medicine, and these specialists are now at the helm of affairs in many hospitals and universities, both within and outside the country. Welcome with me, Professor Olufemi Fasanmade. Hello, sir. Good to have you here.
I'm glad to be here on this program.
Thank you. So we're moving right into it, and our topic of discussion today would be the overcoming health challenges in emerging nations through research. We know you've been in research for decades, and you started your career in research very earlier on in your career. So I would like to know what ignited this passion for research in you.
Yes, I almost accidentally got into the research space. Initially, all I just wanted to be was a good clinician, a good doctor. And I finished my residency about 26 years ago. And when I finished, at that time, I hadn't yet got passed my final exams. And by default, I had to continue working in the hospital, even though I wasn't employed by the hospital. So my then boss, Professor Augustine Overley, he engaged me that rather than just wait to pass the final exam and you don't have a current employment, why don't you just stay on and be a research assistant in the Endocrine Diabetes and Metabolism Division, which I currently head. And at that time, it was quite good because there was a lot of research at that time with the professor. And he was in this very office that we are in today, and that's in around 1993, 94. So I became his research assistant. I was introduced to the calculations, statistics, field work, analysis of data, and several other things. So that is how I cut my teeth in research. So even before I became a consultant, I had done like 2-3 years as his research interest, and there the interests in becoming a clinical researcher came to the fore, because then I still wanted to be a clinician, and I wanted to be like him also, doing a lot of clinical research. So I said, yes, so there's something like clinical research, and that's how today. I am a researcher. I'm still a clinician. And I've added on a third one, which I didn't plan for, which is administration.
Oh, that's fantastic. Such a beautiful story. So you mean right in this office, you also worked here as a research assistant, and now you are currently heading the unit.
Yes.
That's interesting. So based on your experience as an endocrinologist and a seasoned researcher, from your practice, what breakthroughs have you had in research that has really helped us progress your practice? I know you've had so many researches. Can you please highlight one that stands out and how it has progressed practice in your field?
Well, there are quite a number of such research, but I think 2 or 3 of them are outstanding. One of them is the Africa America Diabetes Mellitus study. Prior to that time, very little genetic data was available about the inheritance of diabetes and about the risk factors and etiological factors that cause diabetes. And a lot of research was going on in Europe and in America. And they wanted to say, we have data from these 2 major continents. But Africa looked like a dark continent. They didn't have any information. And they all knew that Africa, however, would be the richest mine for data in the area of genetics, considering the fact that most of the whole world actually evolved from Africa. And that's was very audacious at that time, because our collaborators in the US felt, how are we going to work in Africa? How are we going to work in Nigeria? There are issues of power supply, there are issues of human capital, there are issues of infrastructure. How are they going to use the same high standards that they used to do this research in the US and also in Nigeria? And against all odds, they engaged us in this unit through Professor Theo Johnson, and then some other workers like Mrs. Teresa Rufus, and quite a number of us here, and then others in Ibadan. And also the team in Ibadan was headed at that time by the late Professor Babatunde Oshotimehin, and then the team in Enugu was headed by one of the fathers in endocrinology, Professor John Oli. With that tripod, a lot of data was generated. Today, over 200 papers have been written on the AADM and the inheritance and risk factors of diabetes, with data from Nigeria, data from Ghana, and then later some extra data from Kenya and South Africa. And that is the biggest of such studies. And you only just need to look at any of the papers that came from there. The citations on each are enormous. And that group has evolved over time and connected to other research groups, such as the H3 consortium and several other consortia. Wellcome, Trust, and several other groups have also keyed in and used data from this landmark research. And because of that, the way for research was opened to many people like Dr. Okafor, who was a chemical pathologist, biochemist from Enugu. He got some grants, and he also underwent some study in the US. People like Professor Adibamowo, also Professor Adeyemo, and others also got opportunities to study genetics in the US, and also in Lagos and other places. The door of collaboration was widely opened. Another landmark study that has also emanated through work in which I've been involved in is the Diet Care Nigeria study. And in this Diet Care Nigeria study, it was part of a bigger study, which was a Diet Care Africa study. It was a non-interventional observational study just to look at what are the characteristics of the typical patient that has diabetes in Africa. Because when you are looking at descriptions of patients with diabetes in major research and textbooks, they are describing the American or the Caucasian person with diabetes. We don't have so much from here. But with the Diet Care Nigeria project, we were able to look at what are the epidemiological characteristics of the people in Nigeria that have diabetes. And with that, we're able to say this is the mean BMI of people with diabetes in Nigeria. This is the mean HbA1c of people with diabetes in Nigeria. This is how well they are controlled. These are the common drugs that they use. And this is how their diabetes presents. And these are the challenges. So these two major landmark studies have put Nigeria on the map in terms of clinical research in the area of diabetes, especially type 2 diabetes mellitus.
Thank you so much, Professor Fasanmade. I agree with you that in recent times, finding data for people like us, people within our continent, was a serious challenge. And with this study, I've had to use this study for cardiometabolic portfolio, and it's such a landmark study indeed. And so from your own experience, you have witnessed the pre-technological era in medicine, and you are currently witnessing the growth medicine has experienced through technology. So what would you say the impact of technology has been on medical research?
Well, I would say that it's two-pronged. First of all, with technology, I'm able to analyze data faster and greater volume of data. In those days, when we had to analyze data in this office, I used to use a lot of things like the very analog computers and systems like Quasar.
Yeah.
Then you put in the disk.
I can imagine.
The computer will be clicking. And then when it prints data, you will see things being printed, long sheets that you have to look at. But now, things are much faster.
Okay.
Then even when you want to get research information, we have to go to the libraries to get large volumes of index medicals and other things. But now we don't need to do any of that. Even on your phone, on your laptop, you can easily get to do a lot of things, and information can be transferred very, very fast. The other thing that it has done is that it has opened the doors of new fields of things like informatics. We've had to rely on a lot of statistics now, and then people in the area of mathematics and so on.
So currently, what challenges do medical researchers face in this field?
The challenges that medical researchers face in the field of research today, they are not so much different from what it was before, because the challenges remain infrastructure. We don't have adequate infrastructure. The amount of funding available for education and health is limited in most of the low-middle income countries. So we have a lot of infrastructural deficits. And just like it was some decades ago, we still have the deficit of human capital. Yes, when I was a senior registrar and a research assistant in this unit almost 30 years ago, we used to have 2 or 3 consultants at any given time, and then 1 or 2 senior registrars, and then 1 registrar, and then 1 house officer. It's interesting that 3 decades later, we still have the same number of people. But when I visit other such units or divisions abroad, you have different teams. You can have one team that has 5 consultants and 10 residents.
Wow.
But we don't have that luxury. We still have few people. We still have very few equipment. And for us to even do a lot of assays now, we have to actually collaborate with the private sector. For instance, some of the laboratories, the established laboratories, to be able to even run our assays.
Okay.
That still remains a challenge today. Infrastructural deficit, human capital deficit. So we still are faced with the same things. The only thing that has changed is that the ability to get information is better, because now the world is a global village.
True.
If I can do some things here, I can connect with people abroad or anywhere and can get them done. So that has made things easier. If I can't analyze some things here, I could send it to others who can analyze them even 2x4. So it is the data transfer, data analysis that has been made easy. But all the others are still as tough as they were 3 decades ago and today.
Wow. That's quite profound. So in the light of all of these challenges, where do you see the research industry looking like? Where do you see it going within the next 50 years? Because like you highlighted all of these infrastructural deficits, all of these, the fact that the number of people in the sector are not particularly increasing, that means there's a bit of a stunted growth. So in light of this, how do you think this industry would have changed within the next 50 years?
Within the next 50 years, I do not see problems. Many motivational people have said, if you want to make progress, what you should see is opportunities. So there is great opportunity. For instance, in the area of human capital deficiency, it means that there is a lot of training spaces for people. It also means that people who may have exited the country, they have a lot of opportunity to come back and fill this void. In the area of infrastructure, again, there are opportunities for research in the future. It means that Nigeria is like a virgin land, an untapped resource for a lot of things to take place. New equipment, new technology to be tried in virgin areas. It also means that it's a great opportunity for local researchers to bring in innovative items. It's just like when you look at the automotive industry in Nigeria, and you have people like the Nord Motors collaborating with the University of Lagos. You have people like the and the sky is the limit for them, because now they're in an area where there are very few of them. They couldn't have thrived if they were developed in a place that is already established, like in Asia or US. And it's the same thing that I foresee in the next few decades, that if you decide to sow within this country, within this sector, at this time, up to the next 3, 4, 5 decades, you have a great potential, you have great opportunity. Can you imagine if a Nigerian, for instance, is able to develop a molecule locally within the country that shows promise worldwide?
True, that would be fantastic.
Yeah, that would be fantastic. So that's why I said that there are a lot of opportunities. Opportunities for growth, opportunities for innovation, opportunities for testing even things that have been established elsewhere, because Africa and Nigeria are different from US and New York. What may work there may not work here. And when you are pioneering in such a virgin area, you are able to make giant strides. If people like my academic, for instance, were not daring, you won't see things like Glow. You won't see things like MTN, which are African-based startups, and they now have global presence and global impacts. So nobody will develop this space for us. We have to do it ourselves, and the opportunities are immense for people to tap into.
Thank you very much, Professor Fasanmade. I like the fact that you called our attention to the issue of seeing challenges as opportunities. And it's been a good time having this conversation with you. So lastly, what would you say to the young researchers out there? What would be your advice to young upcoming medical researchers?
I would tell people that research is not so esoteric or as big as people think. Research is just, first of all, the first stage of research is recording observations. Because some people think that to have research, you need to have a molecular lab. No, recording observations, day-to-day occurrences. Data is one of the greatest resources today that everybody wants to mine. So just recording observations. For instance, in my field, how many people have diabetes in Lagos? How many have in Nigeria? How many people have thyroid disease in Africa? How many in Nigeria? Research starts from simple observations. When big industry, big pharma say that they have challenge of data coming from Africa and Nigeria, what they are looking for is something simple. They just want numbers. How many people have diabetes? So that when we are rolling out our products, we know what the market is. What is the spending power of the people? Where do they come from? Are they middle-aged people? Are they people in the lowest socioeconomic group? Are they people in the highest socioeconomic group? What are their characteristics? If a person has a particular disease, what other associated diseases do we expect in that person if he's a Nigerian? Because you cannot extrapolate data from Asia and Europe and US just to Nigeria that way. So that is a great opportunity, even just being able to count. Then after that, being able to use what you have counted or what you have observed to make predictions. That is the next phase of research. And then the third part is being able to now have interventions to change the dynamics and the outcome of the things that you have been able to count and to assess. That is all research is all about. It's not trying to splice or divide the atom into two. No, it starts little and it can build up to great sizes.
Okay.
So young researchers need to know this.
Okay.
First of all, whatever you are seeing, document. Whatever you are seeing, record. Whatever you are seeing, analyze and predict. Use it to predict future trends. Look at what you have counted and you have analyzed today. What was it a decade, 2 decades before? What is it likely to be in a decade and 2 decades from now? That is all. The basics of research start from observation.
Thank you, Professor. You just made research, seem so simple just right now. And I know I said that was my last question. But while you were saying that, something else came to my mind. Before we got on set, you were talking about Twitter and all of that. So I was just thinking, since research is as simple as observation, would you say that social media has an impact on research? And do you think that can truly help us overcome health challenges in the future?
Excellent. Social media, new media, and then technologies can help so much. One of the research I was involved in is telemedicine maturity, to see the hospitals among the federal tertiary center that have a good disposition to the use of SMS, email, Twitter, WhatsApp to consultation. Because during the pandemic, a lot of startups sprung up. And why did they do so? Because they were using the power of technology to cover the boundaries that had to be covered because people could not move. So nowadays, there are a lot of startups that are into healthcare, digital healthcare. And we did that survey and we found out that we've started, but we still have a long way to go. And it is one of the ways in which you can bridge the healthcare gap. Because a doctor who is in the US can be consulting and seeing a patient in Nigeria, and vice versa. A Nigerian doctor can have consulting clinics, and all his clients are from the US. And so what looked like a brain drain can actually become a brain gain, because you can tap the resources of all the people in different parts of the world and then bring them to the clinic in Nigeria. And that's, to me, is mind-blowing. It's an area that everybody should go into. And I use it a lot. I have WhatsApp group for my patients. I communicate with my patients on Twitter, on WhatsApp. I have groups that I educate patients in, and then I record some of my lectures. I upload them to YouTube. We give lectures to medical students via Zoom, via Teams. So it helps to bridge that gap, so that even though you have few, through technology, you can look many.
I like the way you ended that. Thank you so much, Professor Olufemi Fasanmade. It's been a delight having this conversation with you. And you've done great work in this field, and you're such a big resource to us as a country and even as a continent at large. It's been a very insightful discussion. It took us through how he started his career even as an assistant researcher, and even how currently, having been in that industry for decades, how the current technology and our current lifestyle can even help to foster medical research. So if you're out there and you're thinking, will this medical research pay me? Yes, there's so much word out there from experts that have gone before us to say that all that research is just observation. Keep documenting, keep using social media, and keep using technology to foster research. Thank you for this time. We'll see you on our next episode of the Science Capsule. Have a great time.